Good afternoon. Want to make sure you're all still awake. You know how many people told me at the end of lunch that they were so tired? Like, great, I'm presenting in half an hour. So just to make sure you're all there, I'm going to ask you a few questions. Answer just with a show of hands. How many of you have fluoridated water at your home? Oh, quite a few. It looks like about half. Okay, how many of you do not have fluoridated water at home? Quite a few too. Wait, there's another question, Helen. How many of you aren't sure? Okay, there's no shame in that. When I started this work, I didn't know either. I had to call my water system to find out, but I'm going to tell you how to find out. And then, Helen, how many of you get your water from a well at home? Okay, quite a lot of you. All right, so I have some information to share with all of you as well. So I was pleasantly surprised to hear how much Dr. Johnson and Dr. McDaniel talked about community water fluoridation in Pennsylvania. But while I was delighted, they also stole a lot of my material. So I'm going to try not to repeat what you've already heard and maybe tell you some stories and some little tidbits that you don't know about. So among the Pennsylvanians that get their water from community water systems in Pennsylvania, about 56.4% get fluoridated water. And you'll notice, those of you that are keeping track, that that number is different than the one that you saw this morning and that you might see on some literature. It's not because a lot of systems have suddenly quit fluoridating, it's because we've learned more about how the data is collected. So this is actually a more current, more accurate number. It's still not perfect, but it's closer. And if anybody is a data wonk and you want to talk to me about the intricacies of the data and how we did that, come find me. I'm happy to talk about it. So about 33% of Pennsylvanians who are on community water systems get non-fluoridated water, and then the remainder are on wells. And the numbers in this room seem to be pretty comparable to what we're seeing in the state at large. I can't tell you a whole lot about well water, the quality of the water, the fluoride in the water, because Pennsylvania is one of 2 states in the country that doesn't regulate wells. Us and Alaska. So the DEP, who is the regulatory agency for drinking water in Pennsylvania, actually doesn't have the authority to gather those data. But what I can tell you is that the naturally occurring levels of fluoride in groundwater and also in surface water throughout most of Pennsylvania are pretty low, 0.2 parts per million or lower, whereas the target for the optimal range concentration for preventing tooth decay is 0.7 parts per million. So presumably if you're getting your drinking water from a well, you're not getting the benefit of optimally fluoridated water. So this is what our community water systems look like on a map. And there was one of these that we shared at PCOH meetings for a number of years. This is updated from that one. And I'll tell you, a community water system is pretty much what you think it is, but there is a specific definition that DEP uses for a community water system, and that is a public water system that serves at least 25 people or 15 connections year-round. So for instance, if there was a seasonal community like a campground that provided drinking water to more than 25 people, but they were only open part of the year, that would not be considered a community water system for these purposes. So those shapes, those blobs there that you're looking at, those are our community water systems. There are almost 2,000 of them in Pennsylvania, and you know, that makes sense when you think that a community water system can only serve 25 people. There could be a lot of community water systems, and it's a lot to keep track of, which is part of the problem with getting accurate data. It's just a lot. It's just a lot. The blue ones there represent the fluoridated systems. The red ones represent the non-fluoridated systems. And the few there that are in green are ones where we know that part of that service area is getting fluoridated water and part of it is not getting fluoridated water, but we don't know enough to break it out into blue, or red. And the tiny URL there, you'll see that again, and there are postcards on the materials table over in the exhibit room where you can go to look at this map, and I'll tell you more about what that looks like later. So how does Pennsylvania compare to the rest of the country? Not especially well. As you can see, we're at about 56.4%, whereas 73% of all US residents on community water systems are getting optimally fluoridated water. And that's even lower than the Healthy People 2030 goal, which is 77.1%. So you can see that there's room for improvement, right? And we do have some work to do. So what are we doing about it? For starters, we're trying not to lose ground. Ideally, we're expanding that number and reaching more people with fluoridated water, but it really takes most of my time just to maintain what we have. What you're looking at there in red, with the exception of the shining star of Meadville for our initiation up there, those are all communities that have faced rollback threats. Threats of discontinuing existing fluoride programs just in the 4 years since I've been doing this work. So that's how many communities where we've put our time and attention and resources trying to just maintain what we have. You might wonder, what in the heck is going on, right? Why are there so many of these? And really the answers that we have to that come from people like you. That have worked with me over the last 4 years to try to maintain these systems. So is there anybody in here who is on the statewide fluoridation task force or has worked on? I know some of you are, don't be shy. Yeah, because you're awesome. And I mean that sincerely. It would be impossible to do this work without people like you. Those task force members are people that are volunteers that have been trained in fluoridation advocacy and that are willing to step up when a threat comes up, to go attend public meetings, to write letters, and so forth. And we offer a training for advocacy. Thank you, Angela. Every other year. So in years alternating with the summit, in the summertime we will offer an advocacy training that people can come to, and it can be a refresher course if you've already had it, or it can be for new folks. And I really encourage you to consider doing that because it's a fantastic training. The American Fluoridation Society comes up and does that for us, and it's really, really worthwhile. So back to me saying that what we know about what's going on here comes from you. It's because it's crucial to have a local champion when something like this comes up. And you would think there's all the state dental associations, the dental hygiene association, there's PCOH, there's a lot of statewide and national and even international organizations that could come and rally, but they are, even with all of their collective expertise, aren't nearly as effective as someone who is personally affected by that decision, someone who lives and works and votes in that community. Another really critical reason why you want a local person is because they can find out things that outsiders like me can't find out. And I'll give you an example of that by way of a story. In Shippensburg, a couple of years ago, Marissa knows this story well, we found out about that threat, believe it or not, by a screenshot of a tweet of a photo of a notification letter on an anti-fluoridation Twitter site taken by Matt Jacob, who is a national consultant in oral health, and he sent it to me. And all the notice said was, we've been providing fluoridated water to you for 32 years. We're thinking about stopping. We're going to hold a public meeting next week. It was very short notice. So that's all we knew. And immediately we set about looking for that local champion. And the Pennsylvania Dental Association is a tremendous partner in this work. Marissa and I communicate frequently. However we find out that this is going on, we start pooling our resources to find a local champion. And Marissa found Dr. Gary Davis, who lives and practices in Shippensburg. And he not only went to the meeting and brought 50 friends with him, the most important thing he did was he went and talked to the local authorities, the water authorities, to find out what's the reason, why is this coming up now? And what we wouldn't have known is they had a problem with the supplier. They treated with sodium fluoride, which comes in 50-gallon barrels, and their supplier would only deliver the drums to one site, and they fed fluoride at multiple sites. So their water operators had to handle this stuff and move it around, and also the supplier wouldn't take the empties back, so they had to figure out how to get rid of them. So they had just decided that this just isn't worth the risk to our water operators' safety, and we're going to discontinue it. So with that information, I was able to go to the fluoridation engineer at CDC and say, look, this is the problem we're having, can you help? Sure enough, she found a supplier, they connected, solved their problem, they continued fluoridating. But we wouldn't have known that, right? We could have brought all the people in the world to that meeting and given them all the evidence, all the science, and that wouldn't have fixed their problem. And another thing that he did that was really helpful is he didn't just, say, okay, my work here is done, right? He stayed in touch to see how things were going and let them know that PCOH was offering some fluoridation equipment grants, which they applied for and they received. And part of the agreement for those equipment grants is a commitment to continue fluoridating for at least 5 years. So that is just an ideal case scenario of how this goes. But the critical piece really is that local champion. So I encourage you to consider becoming one. If you haven't had the training and you're asked, don't worry. That's why I'm here. I will provide you with whatever information and support you need. So a couple other things that we're doing to maintain the existing systems is to promote an online learning course called Fluoridation Learning Online, or FLOW, which is free, and it teaches operators how to safely handle the chemical. The equipment grants, which we've heard about, and the guarantee that comes with them. Since April of 2020, we have awarded 10 of those grants to systems serving almost 500,000 people, totaling over $200,000. And so that's 500,000 people that are guaranteed to receive fluoridated water for another 5 years. So we really appreciate being able to offer those grants and hope to continue doing that. And that's something that you all, again, can share in your community, share with your communities in case that's of interest to your systems. And so we are still trying to, in our spare time, increase the percentage of the state population that's receiving fluoridated water. And what we're doing to do that is develop relationships with decision makers in the municipalities and at the water authorities, because ultimately it's going to come down to 3 or 5 or 7 people who are going to make that decision. So reaching those people, getting to know them, building relationships, sharing information, that's really key. So can I go over? I have a story. I just got the 1-minute warning.
It's your conference. I mean, whatever.
Okay, I'm gonna tell you just a couple stories because it. Unless they bring out the cane, right? So what we do is we go to, there are 4 statewide water operator associations that have annual statewide meetings, and we go to those as an exhibitor, which supports the organization, shows our interest, And what I do is I take all my information, literature, why you should fluoridate, equipment grants, yada, yada, yada. And the most important thing I bring is toothbrushes and toothpaste, because that brings them to the table, right? Everybody wants a toothbrush and toothpaste, and they're curious. They're like, what are you doing here? There's all the other exhibitors are engineers, heavy equipment sellers, right? And then there's, the fluoride lady, they call me. So the first one I went to was a Municipal Authorities Association meeting in Erie, and I was brand new to this work. I really didn't know a whole lot, but I just went and I took my toothbrushes and toothpaste, and I was texting Helen from the table because they would come out. This is like a big conference, like 400 or 500 people, and they would come out in groups of 3, 4, 5, 7, and it was like an angry mob, right? They're around me telling me how much they hate fluoride. Some of them call it the F word, and they mean it. So I was like, Helen, this just happened, and this just happened, and I can't believe this. And because I was so new and I didn't know what to say, the only thing I knew to do was to ask questions, which turned out to be a really happy accident, because I would say, really, why don't you like it? What's the problem? Why do you want to discontinue? And I learned so much about what the hesitation was. What were the risks? How was it affecting them, right? On the surface, you would think, water fluoridation is great. Why are you not all doing it? Well, there are some really good, valid reasons. And once we know what those reasons are, then we can begin to address them. So, and Deb and I had a conversation about this earlier today, and how we can build on how we reframe and communicate with the decision makers about this. It's really listen more than you talk, right? The impulse is just come out guns blazing and throw them all the information and say, fluoridate, go, like Dr. Johnson said this morning. I thought I would just go present the evidence and they would say, yeah, and it would happen. So that's one of the really valuable things. And just here's my quick story, and then I'm going to move on. But at that first one with the angry mob, one of them was a woman who told me that they fluoridate, but she wishes they didn't because she hates it. But she's going to keep doing it because it's a good tracer. And I didn't know what that meant, but I just kind of nodded and said, yeah, it's a good tracer. What that means is fluoride doesn't dissipate over time in the water. So you can trace it, you can use it to trace where leaks are. So it has that added benefit. And then tuck that piece of information away, because it's really useful when you pull that out of your back pocket. People say, oh, they know what they're talking about, right? So anyway, this woman, she kept coming back. I happened to have full tubes of toothpaste at this particular conference, and she came back, and I think she came back 3 times, and she still didn't change her tune. And I thought, well, I'm never going to win this woman over. But as she was walking away, I just said, careful, it's got fluoride in it. And she didn't turn around, and she just did one of these. But at the next conference I went to, she greeted me like an old friend and introduced me around, and it was really wonderful. So, moving on quickly. You've probably heard of My Water's Fluoride. I'm just going to say quickly, I'm going to suggest that you pause using it for now. It's a CDC website based on information that goes into a CDC website called Wafers. And then the public-facing side of that is My Water's Fluoride. You can go to that and find out whether or not your water is fluoridated. You have to know the name of your water system in order to do that. Does anybody know the name of their water system?
I just looked it up, it works.
It works, but it's not accurate. It's partially accurate. The reason that it's not accurate is because the data that populates it hasn't been updated in about 10 years. Okay? We're working on that. We're working on getting it up to date, but in the meantime, we developed something that we think works better for Pennsylvania, and that's where we come to the maps. How am I doing on time? Way over? Okay. Sorry, get me talking about fluoride, Ellen. Okay, so that tiny URL, it's on the postcards over there, will take you to this landing page that'll give you some basic information about fluoride. That's the first tab there, and then the second tab says search by address, and that's where you come to. You enter your address at the top. I've entered the address for where we are right now. And what this tells us is that we are served by Suez Water, PA, Harrisburg, and that it's non-fluoridated. Okay, and you can also look for, and that's that red blob there, that's the outline of the service area. Kind of looks like a congressional district, doesn't it? You can look up school districts, zip codes, municipalities, counties. And then if you want to get really fancy, you can go to the third tab, enter your address, and this stuff I love. There are multiple layers that you can put on top of these. You can overlay your congressional or Senate district, state and federal. You can overlay school districts, municipalities, DHIPSAs. So it's a really useful tool, especially for advocacy, because when you find out that there's a rollback threat, you don't have a whole lot of time to locate that information. So I would encourage you to check it out, enter your address. Couple of caveats. If you're on a well, it's going to tell you something that's wrong because we don't have the data on private wells. And it'll direct you to, it'll prompt you and tell you that we don't have well information on there. And also the data, these maps are only as accurate as the data we have, which is getting better. It's still not perfect. And believe it or not, really the best way to know for sure whether or not your water is fluoridated is to call your water system. Just call them up. But even sometimes they don't know, or they won't tell you the exact truth, right? Amy, that's another story, but I'm out of time. So I will leave you with this picture of Luke, who, as you can see, is clearly pro-fluoride. So thank you for indulging me.